Welcome to Beach Eyecare. You've joined us in the intralaser suite for your intraLASIK procedure. Here we'll begin that process of creating the flap with the computer-controlled accuracy and precision of the intralaser. We introduced this technology to Virginia back in 2002, and it's been FDA approved for 5 years. Dr. Jain, tell us a little bit about it.
Together, Dr. Nichar and myself have performed over 8,000 intraLASIK procedures. When you arrive, the informed consent will be there for you to sign. Any questions that you may have will be answered. You'll be receiving pre-op drops as well as Valium if you decided to have that to help relax or calm you during the procedure. When you arrive to the intralaser suite, you'll be prepped with betadine, and Dr. Nichar will tell us a little bit about the intralaser machine.
Great. Thanks, Dr. Jain. With the intralaser, we'll be actually bringing the laser to you called docking. When we do that, you don't have to worry about blinking because we use a ring that keeps you from blinking. When we dock, you'll feel a pressure sensation, kind of like a sinus headache, and your vision grays out, so you don't have to worry about looking at the red light that's up in the circle of lights that you'll see initially. And Dr. Jain will talk a little bit more about the computer-controlled accuracy and precision of the intralaser.
With computer-controlled accuracy, we'll be selecting the hinge position, the size of the flap, and the depth of the flap to create the intralaser flap for you. The laser will be firing rapidly at 60,000 pulses per second. Procedure time will take roughly 20 seconds to create the flap. Then we'll be checking the thickness of your flap with the ultrasonic probe, treating the other eye if it needs to be treated, and then Dr. Nichar will talk about the Nidec laser.
When we come to the excimer laser correcting part, if we're using the Nidec laser as we do for monovision eyes, where we want to leave you some reading vision or give you reading vision with farsighted treatments, that's performed right here in this room. Right behind me is the Nidec laser. And with it, you'll be looking up at a red solid light or green blinking light during the laser treatment. It has a tracker, so you don't have to worry about moving. There's a lid opener, so you don't have to worry about blinking. And cricket-like noise of the laser. A little bit of a funny smell from the gases of the laser is normal too.